Good morning everyone. Myself Dr. Geetanjli Chawla, Assistant Professor from the Faculty of Physiotherapy, RPIIT Campus, Karnal. Welcome to our YouTube channel, that is RPIIT Academics. Do not forget to hit the like and share button if you like the video. Do not forget to hit the bell icon and do not forget to subscribe the channel. So today we are going to learn about deep vein thrombosis. So what is deep vein thrombosis? Venous thromboembolism is a condition in which a blood clot known as thrombus forms in a vein, which in some cases then breaks free and enters into the circulation as an embolus, finally lodging in and completely obstructing a blood vessels, like in for example in lungs, causing pulmonary embolism. And the most common type of venous thromboembolism is deep vein thrombosis, which occurs in veins deep within the muscles of the leg, arm and pelvis. A superficial venous thrombosis, also called phlebitis or superficial thrombophlebitis, is a blood clot that develops in a vein close to the surface of the skin. These types of blood clots do not usually travel to the lungs unless they move from the superficial system into the deep venous system first. So if we define the deep venous thrombosis, then it would be deep vein thrombosis is the formation of a blood clot in one of the deep veins of the body, usually in the legs. So what are the symptoms? Common symptoms will include swelling in your foot or ankle or leg, and it will be usually on one side only, and cramping pain in your affected leg that usually begins in your calf. It would be very severe unexplained pain in your foot and ankle. An area of skin that feels warmer than the skin on the surrounding areas, and skin over the affected area will turn pale or reddish or bluish. Discoloration will occur. If we talk about etiology, it would start in the lower extremity calf veins, then it would progress proximally to involve, then it will involve the popliteal, the femoral area and the iliac system. Virchow triad, it is the very basic of deep vein thrombosis and very important. More than 100 years ago, Rudolf Virchow described the triad of factors of the DVT, which contains venous stasis, endothelial damage and hypercoagulable state. They all make a vicious cycle. One cannot escape from this cycle. So what is venous stasis? Venous stasis is the prolonged bed rest. It happens because of prolonged bed rest, maybe 4 days or more. A cast on the leg or the limb paralysis from the stroke can cause venous stasis, and spinal cord injury patients can have venous stasis, and in cases of extended travel in a vehicle. Hypercoagulability happens after any surgery or trauma in 40% of all thromboembolic diseases. Malignancy, increased estrogen, inherited disorders of coagulation like deficiency of protein S, protein C and antithrombin factor 3. Acquired disorders of coagulation like nephrotic syndrome and anti-phospholipid antibodies. All these can lead to hypercoagulability. And what is endothelial injury? It generally happens because of trauma, surgery, invasive procedures and because of any iatrogenic causes like central venous catheters. The iatrogenic causes are those causes which we acquire from the hospital. The subclavian or the internal jugular lines, and these lines can cause the upper extremity deep vein thrombosis also. Thank you.